Hello, I'm Dr. Chris Chitana, a pediatric otolaryngologist at Nationwide Children's Hospital and The Ohio State University in Columbus, Ohio. I have cared for many children who have suffered serious injury from button batteries. Each year, approximately 3,000 button battery ingestions are reported in the United States, and this is likely just a fraction of those that actually occur. As a result, children have had life-changing consequences, and in other cases, fatal complications from button batteries. Many devices, including remote controls, toys, games, flameless candles, hearing aids, bathroom scales, digital thermometers, and numerous other button battery-powered devices can be found in the household setting. The challenge parents and even medical professionals have is that initial signs or symptoms may not be present, or they may be nonspecific, no different than a viral illness we commonly see in kids. Many events are unwitnessed, so caregivers are unaware it even occurred. Symptoms of button battery ingestion may include wheezing, difficulty breathing, coughing, choking, gagging, difficulty swallowing, decreased appetite, vomiting, and chest pain. If the button battery was placed in the nose or ear canal, drainage or bleeding may be present. Many of these ingestion events are not witnessed, and the clock is ticking from the moment the button battery is lodged inside the body. The current from the battery creates a high pH that breaks down tissue rapidly, and serious damage can occur in as little as 2 hours. Button batteries of all sizes can cause serious injury when lodged in the body. The smaller batteries, less than 20 millimeters in diameter, are more commonly placed in the ear canal or nasal cavity and have caused the following complications: a hole or perforation inside the nose, scar tissue formation blocking the nasal breathing passages, infections of the sinuses and around the eye, injury to the eardrum, hearing loss, and other injuries. Smaller button batteries can become lodged in the esophagus of children less than 12 months of age and have caused significant injuries. The larger 20 millimeter diameter and greater button batteries have 3 volts of power, which can lead to a faster rate of injury. When a button battery is in the esophagus, the following injuries can occur: a hole or perforation in the esophagus, the nerves to the vocal cords paralyzed, an infection within the chest, a connection created by tissue destruction between the esophagus and airway, or, most life-threatening, into a major blood vessel close to the heart. If a button battery ingestion or placement into the ear canal or nasal cavity is suspected, a child needs to be taken immediately to an emergency room for evaluation and X-ray imaging. The diagnosis can be confirmed on X-ray, where from a distance can sometimes be mistaken for a more commonly ingested foreign body, such as a coin. The key to diagnosis is to magnify or zoom into the image and look for the double ring or halo sign seen with a button battery. On the side view, one can sometimes see the step-off of the battery edge. The treatment for a button battery lodged within the body is emergent removal. When placed into the ear canal or nasal cavity, this can often be accomplished in the emergency room setting. When lodged in the esophagus, this requires general anesthesia for removal in the operating room. Depending on the severity of esophageal injury, consideration is made for a nasal feeding tube into the stomach, and the child may undergo an X-ray while swallowing contrast dye prior to feeding by mouth to ensure that no hole or perforation is present. Even after removal, the injured tissue can continue to break down or excessive scar tissue form, leading to delayed complications and the need for further imaging or intervention. Surveillance for delayed complications should be considered in all cases. In some severe cases, additional surgeries, including direct feeding tube placement into the stomach, tracheostomy or breathing tube placement in the neck, are required. Prevention is the long-term solution to this problem. Even dead batteries that no longer power products can cause injury. Please properly dispose of them immediately after removing from a device. Store new button batteries in a locked cabinet out of reach of children. Check all button battery containing devices in the household to make certain they have a secured compartment where a tool such as a screwdriver is needed to access the battery. Do not hesitate to call the National Battery Ingestion Hotline at 202-625-3333 to report any cases or with any questions. Additional information on the dangers of button batteries is available at www.healthychildren.org. Thank you.